Hello, welcome to our patient teaching video on congestive heart failure. Learning objectives of this simulation include to better understand the pathophysiological mechanisms that lead to congestive heart failure, to understand the common medications that are used to treat CHF, including ACE inhibitors, ARBs, diuretics, beta blockers, and calcium channel blockers, to understand important lifestyle modifications such as diet and exercise that can reduce the impact of CHF, to better understand the illness experience of a client living with CHF, and to give students a better idea of what community resources are available to those living with CHF. Jan Smith is a 67-year-old woman who went to see her family doctor due to increasing shortness of breath and swelling in her ankles and feet. She has a history of uncontrolled hypertension and high cholesterol. Her doctor referred her to a cardiologist to receive an ECG, stress test, and echocardiogram. The echocardiogram has shown left-sided hypertrophic cardiomyopathy. The cardiologist has diagnosed congestive heart failure, and she is now being discharged. Come on in.
Hello, my name is Eric, and I'm going to be your nurse today.
Nice to meet you.
Would you mind if I took a look at your arm bracelet?
Sure.
Could you tell me your name and your date of birth?
Jan Smith, April 21st, 1951.
Perfect. Just going to make sure I got the right person. So I'm here to do some patient teaching today because your doctor says you're going to be getting discharged soon. Yeah. So would now be a good time to chat, or would you like to talk later?
Now is great.
Okay, perfect. So normally the way I like to begin is I'd just like to ask you, what do you know about congestive heart failure?
Well, my doctor told me that because of my high blood pressure, my heart has become weaker.
Yeah.
And so then my heart isn't able to pump enough blood around my body. And normally my blood carries nutrients and oxygen around my body. So that's why sometimes now I'm getting tired and I need to take breaks.
Perfect. Yeah, that's exactly right. So with hypertension, the pressure in your blood vessels has been increased over a number of years, and your heart has had to work harder to compensate for that. So what's happened is your heart has become enlarged, just like any muscle would. Like if you went to the gym and started lifting weights, the muscle would get larger. And so normally that is a good thing. But in this case, what's happened is your heart has gotten larger, and now it's not able to contract properly. So some problems around with that is the ventricles, for example, they may not be able to fill up with enough blood as much because of the enlarged muscle. And so that would be a diastolic problem. And also you can have a systolic problem, which is when your atria can't contract properly. So with those combined, what that means is organs in your body, like your brain or your kidneys, they start to receive less blood and nutrients, and that's what makes you feel tired and weak. Okay? So right now you've actually been diagnosed with left-sided heart failure. And what that means is your left side normally receives oxygenated blood from your lungs, and it pushes it out to the rest of the body. But with left-sided failure, what starts to happen is the blood will actually go back into your lungs, that causes the wet cough, or it can manifest itself in the shortness of breath that you've been experiencing. Okay. It's also really common that when you're laying down, you might feel that shortness of breath as well. Also, what sometimes happens is you actually will develop right-sided failure. And so when that actually happens in response to the left, and so what the right side does is it receives the deoxygenated blood from the rest of your body and it pumps back in. But what happens is in right-sided failure, it starts to back up and go down to the rest of your body, and that can manifest itself in edema. You've had the swollen ankles, right. And so that's what that looks like with the right-sided failure. Okay. So we'd like you to keep an eye on that. So does that make sense to you so far?
Yeah, for the most part, yes.
Mm-hmm. So could you explain to me what left-sided heart failure is?
So left-sided heart failure happens when my heart is not pumping enough blood to the rest of my body. Mm-hmm. And this makes me feel tired because my blood carries nutrients and oxygen. And fluid can back up into my lungs. That's why I've been having the cough and why I've been feeling so short of breath lately. Perfect.
Yeah, it sounds like you have a pretty good understanding. So how are you feeling about this new diagnosis?
Well, I'm feeling a little overwhelmed about everything and just nervous that I won't be able to do all the normal things I'm used to doing.
Mm-hmm. That's really understandable. It's a lot to take in all at once, for sure. What have you done in the past to help you cope with challenges?
Well, when my father passed away, I didn't cope very well, actually. I fell into a mild depression. Luckily, my husband really supported me through it.
That's wonderful that you have such a supportive husband. What kinds of ways did he support you back then?
He always validated my feelings and let me vent. He also helped with household chores that I was used to doing, as I found it hard to find the motivation to care about those small tasks.
Mm-hmm. And how long ago was that?
That was about 3 years ago now. I've felt okay ever since. I never took any medication, but I went to cognitive behavioral therapy, and I found that really allowed me to recognize my negative thoughts and change my behavior and help me get back to my old self.
That's really good to hear. It's important that you self-reflect and to continue to monitor your thoughts, especially now that you do have this new diagnosis. Do you feel that this might cause you to become depressed again?
I don't know. Will I still be able to do all the things I can normally do?
Mm-hmm. What kinds of things do you normally do?
Well, my husband and I go bowling with our group every Sunday, and I go for my walks every day, and I also like to keep the garden looking nice.
Mm-hmm. Yeah, well, it sounds like you should be able to do all those things. It's just important now that you do manage your CHF, and so the way you're going to be doing that is you're going to be taking your medications, and you're going to have to keep in mind now that you may not be able to do those things as quickly as you did before, and you're going to have to put in some adequate rest time. So just be mindful of getting fatigued while you're doing that and being sure that you can plan to take rest as you're doing those activities. But you should be able to continue doing them.
Okay, great.
Do you have any other concerns about CHF?
Well, I am kind of wondering if my husband and I can still be intimate.
Mm-hmm. Yeah, that's a great question. So you can definitely still engage in any sexual activity. It's just, again, it's important that you be mindful of how tired you're getting. So a good way to kind of judge that is you shouldn't be more tired than you would be as if you walked up 2 flights of steps. So again,
Okay.
You may need to take breaks, and this is just something that you and your husband can have a discussion about.
Okay, thank you.
Mm-hmm. Would you mind if we started talking about how you've been managing your hypertension so far?
Sure. I've been taking my blood pressure medication, prandopril, and my cholesterol medication, rosuvastatin.
Mm-hmm.
The doctor also recommended that I increase my physical activity, so I've been trying to go for 3 walks per week, and I've been trying to reduce my salt intake. But I find that one very difficult. I tend to eat a lot of cheap and quick foods like soup or frozen dinners.
Mm-hmm. Yeah, it can definitely be difficult to eat healthy food, especially when it costs more and it takes longer to make. One dietary concern here, though, is the amount of salt that comes in those frozen dinners. The recommended intake of salt for CHF is about 2,000 milligrams a day. And so it's probably likely that you are going over that with some of those frozen dinners. And essentially the reason why salt has to be lowered is because the more salt you have, the more likely you're going to have fluid retention and contribute towards that hypertension. So would you be interested in some resources to help you cook with less sodium and some resources to help you find some more healthy eating options?
Yes, absolutely. That would be really helpful. I have tried to lose weight in the past.
Yeah.
I've struggled. I didn't get the results I wanted, but I would like to try again.
Okay. That's great that you're interested in wanting to lose some weight. It looks like your weight is only just slightly above the healthy range, so but even slight reductions in weight can have a positive impact on your CHF. You're doing a great job with exercise so far. Maybe what we could work on, though, is just increasing it by a little bit. The actual recommendation for exercise is 5 times a week for 30 minutes, and so that's only a little bit more. Do you feel that you could do that, or do you think that's a little bit too much?
No, I think I could do that.
Mm-hmm.
But the thing is, I have been feeling a lot more tired than usual lately, and I always need to rest after my walk.
Mm-hmm. So the new medication that you've been prescribed should help you with your fatigue. We are going to have that covered with our pharmacist, Taylor, and she's going to come in and speak to you a little bit about that just to clarify everything there. And so while you guys are chatting, I'm going to go ahead and pull up some of those resources for you, and we can have a chat about that when I come back.
Perfect, thank
All
you.
right. Thanks for speaking with me.
Come on in.
Hi, I'm Taylor. I'm the pharmacist.
Hello.
And I'm here to discuss your medications with you today.
Okay.
So I understand you've been taking rosuvastatin and perindopril, is that correct?
Yes.
Can you tell me what you know about these medications?
I just know that prandopril helps lower my blood pressure and that rosuvastatin helps lower my cholesterol.
Exactly. So perindopril is an ACE inhibitor, and it helps relax your blood vessels, which helps decrease your blood pressure. It also helps with heart failure because your heart doesn't have to work as hard. Your rosuvastatin, it works by blocking an enzyme in your liver, which decreases the production of cholesterol in your body, which may build up in your arteries, blocking blood flow to the heart.
Okay, that makes sense.
So your doctor feels that the perindopril is not sufficient to manage your hypertension, so she has prescribed a few more medications. So you've been prescribed metoprolol, which is a beta blocker, and indapamide, which is a thiazide diuretic, to help lower your blood pressure. So beta blockers work by making your heart beat more slowly and with less force, which helps reduce your blood pressure. Beta blockers also help with heart failure by allowing more time for your heart to fill with blood, increasing the amount of blood that leaves your heart with each beat. Does that make sense?
Yes, I think so.
So the side effects of metoprolol include dizziness, weakness, drowsiness, fatigue, headache, upset stomach, and diarrhea. So you should let your family doctor know if you experience any of these side effects.
Okay.
So you've also been prescribed indapamide, which is a thiazide diuretic. Diuretics work by increasing your urine production, by increasing the amount of sodium and water that is filtered out by your kidneys. And this medication will get rid of that extra fluid that's causing your shortness of breath and your cough and the swelling in your feet and ankles. And getting rid of this extra fluid will also help decrease your blood pressure and will help your heart beat more easily. Does that make sense?
Yes, for the most part. Thank you for explaining it all to me.
So some side effects you will need to watch out for with indapamide include weakness, muscle cramps, and dizziness. So again, you'll want to let your family doctor know if you experience any of these side effects. Okay. So indapamide can also cause low potassium and low sodium. So your family doctor will talk to you about getting blood work done in about a week and then again every 6 to 12 months. So you should also make an appointment with your family doctor in about 6 weeks so she can assess how well your medications are working and make adjustments if that's needed.
Okay, that sounds good.
So let me know if you have any other questions. You can call the pharmacy anytime.
Sure, thank you.
Hey, Jan.
Hello.
Hey, I'm back again with some of the resources to talk about for you.
Great.
So it's Nova Scotia actually has quite a bit of resources. We have a lot of free community health programs to choose from. So there is a 12-week program that helps with weight management, and we've got locations in Dartmouth, Bedford, and in Halifax.
Great.
It's led by healthcare team professionals, and you can learn about how nutrition, physical activity, emotions, behavior, and the environment all affect your health. Is this something you'd be interested in?
Yes, definitely. That sounds like a good option. Maybe then I can also make some friends who are trying to live a healthier lifestyle as well.
Absolutely. Yeah, it's much easier to make healthier choices when the people around you are doing that as well. It's really encouraging. So you also mentioned earlier that some of the healthy food options seem to be more expensive for you. So there's also some community workshops around that we can hook you up with that can help you make the most of your food dollar by teaching about meal planning, preparations, and some smart shopping tricks.
Perfect. That sounds exactly what I need.
Mm-hmm. And also, we have another program. It's an exercise program that you may want to take advantage of. It's a 4-week introduction. It's a cardio program. There's also a 4-week strengthening program. And we also have a stretching and core stability program. And you could also join an outdoor walking club to meet people and socialize. Any of those sound interesting?
I like the idea of a social walking club, and maybe I should look into some strengthening. I've never done that before.
Okay. Yeah, well, we'll certainly hook you up with some of those then. So that's everything that I need to cover today, Jan. Is there anything else that you'd like to speak to me with?
No, I think you covered everything. I don't have any questions. Thank you again.
All right. Thanks for coming in. Do you mind if I take a seat?
Yeah, no problem. My name is Jan. Nice to meet you.
Nice to meet you as well, Jan. Okay, right there.
Thanks.
Would you mind if I took a look at your armband?
Sure.
Could you tell me your name and your date of birth? Okay. So I'm here to do some patient teaching today. I forgot what I'm doing.
Come on in.
Hi, oh my god.
Come on in.
Hello, I'm Taylor. I'm the pharmacist, and I'm here to discuss your medications with you.
That's my fault. That's my fault. Sorry.
Oh, man.
Come on in. Hello. I'm Taylor, and I'm the pharmacist. Nice to meet you. You're good. Oh my gosh.